Can you believe we're going to be talking about pee today?
Can you believe we're old enough to be talking about pee in a different way today?
The last time I think I talked about pee was, when babies pee and you have a little boy and you change the boy's diaper and you get a little arc.
Yeah. How
Those
our
pee-pee
lives have
pee-pees?
changed.
Yeah.
Oh, right. How our lives have changed.
Yeah,
They
not
are.
changed at all.
No.
We're still talking about pee.
That's
Yeah.
true.
Well,
That's
we
true,
are at a
that's true.
different part of our spectrum now, but hey, that's the way it goes. That's life, right?
Exactly.
Circle of life.
Exactly.
To pee or not to
And
pee.
so now you know what we're talking about. We're talking about incontinence. We're talking about how women tend to get to a certain age and have issues with peeing accidentally or leaking accidentally. And luckily, we're here on Avaaz podcast today to talk about all things incontinence. And we're here with our doctors, Dr. Jeethi, Dr. Madhu, and Dr. Nav. And I'm Roop, your host. So, as I understand, there are 3 types of incontinence. There's stress incontinence, there is urge incontinence, and there's overflow incontinence. And I had to look those up on my notes here, otherwise I wouldn't remember them, because all I know is incontinence is you have trouble keeping your urine
Control of
into
your
your
urine, yeah.
bladder.
Yeah. It's basically a bladder control issue.
Yeah.
And the accident loss of urine. So which one of you wants to take on sort of the description of it or the definition of it?
Well, I'm happy to do that. So, so the reason we're talking about incontinence today is because it is so common, but I'm going to talk about a little bit more about like, what is incontinence? I mean, I guess we can all kind of pipe in, like, what is incontinence? Like, what are some of the examples that we're going to be giving? So, I mean, I can, like, off the top of my head, I can think of a few, like when you laugh and you pee, or if you laugh too hard, or if you sneeze and you pee, or you cough, or you're like, running to like run for something, or
playing pickleball.
Or lunging
pickleball. That's all.
Okay, the worst one for me is skipping rope.
Yes.
Yes, anything that's jumping.
Yeah.
I was once dancing and jumping. I did not enjoy it.
Yeah. No, I have to pee immediately before I'm jumping rope at the gym for sure.
The fact that you will even jump rope at the gym.
Yeah.
Applaud. No, I tried that.
Knowing what we
Didn't
know.
go the way I wanted it to.
Yeah.
I said, no need to do that.
So it's very common. So that's why we're talking about this.
I mean, we have sayings like, "Oh my God, I laughed so hard I peed my pants."
Yes.
Or "मैं हंस-हंस के मर गई पेशाब निकल गया."
Yes.
So I mean, it's cross-cultural, ladies.
Exactly.
So why is it so common? Why? I mean, 4 out of 4 on this panel have experienced it. That's 100% right there.
Yeah.
Why is this so common?
So it's a very common problem. In fact, like in women, we get it 2 to 3 times more often than men. But the problem is like, it's downright embarrassing to talk about it. Like, none of us want to tell our friends or our family. I mean, the only reason we're talking about it is because we're, medical people. And so we know it's not anything to be embarrassed about, but it is something that women traditionally, like, who wants to talk about wetting themselves, right? So it's, it just sounds horrible. Yeah.
And why are we talking about this in relation to South Asian women?
I think we're talking about because we don't talk about it. It's very common. Most of my friends, South Asian, non-South Asian, have experienced this. It's also, there's a certain shame. You don't want to be vulnerable about it. You don't want to be honest about it because it's embarrassing. And I think also there's a generational gap where the older women of our generation, like our moms, I don't think anyone talks about it. My mom certainly hasn't talked about it with me. I don't know if your moms have, but it's not something we talk about. And there's also a role of the primary care physicians that we perhaps don't ask our patients, hey, do you have any issues with incontinence? And then if you have a male primary care provider, I think a lot of women would be a little bit embarrassed, or they'll hold back and they won't talk about it.
Totally.
So I think we're trying to normalize the conversation that it's common, it happens, and there are ways that we can mitigate this and talk about it and help you.
Dr. Jeethi, can you explain a little bit about what causes incontinence?
Sure, Rup. Going back to why it's so common amongst women, pregnancy, childbirth, big reasons why we all have urinary incontinence. What happens is during pregnancy and in childbirth, the ligaments that hold up the uterus and hold up the bladder become kind of lax, loose. So those organs drop, or the other word you might hear is prolapse. And that's a common cause of incontinence. Also aging, certain health conditions, being overweight, poorly controlled diabetes, having like a chronic cough, that can bring it on as well. And then there's some disorders that affect your nervous system, where the connection between the signal or the nerve signal going to your bladder is disrupted. And that can happen in things like multiple sclerosis, and strokes, if you have a spinal cord issue. And then there's some temporary things that can cause urinary incontinence, such as having a UTI or a urinary tract infection. It's a common cause. And then even something as simple as constipation can make you more likely to have incontinence. And then there's lifestyle factors, things we do that contribute to this happening. And that includes drinking caffeinated beverages, a lot of coffee, a lot of tea, alcohol, and physical inactivity, and smoking. Those are all known to be risk factors.
And of all of them, would you say that having been pregnant and carried a child is one of the biggest factors?
I think it certainly significantly contributes to this problem in women. It has to do with the anatomy and the ligaments just becoming lax.
Especially vaginal delivery, so as opposed to having a C-section.
So it's true that having vaginal deliveries does increase your risk, but even having C-sections, just being pregnant is definitely a risk factor, because I haven't had vaginal deliveries, but I've had 2 C-sections, and carrying those pregnancies, I have very similar issues.
Okay. So we were talking about the different kinds of incontinence. We know now what can cause it, and there's so many different factors, as Dr. Jyoti went over it. The 2 most common types of incontinence are stress incontinence and urge incontinence. So let's explain a little bit more to our listeners what that means.
Sure, yeah. And before I get into that, I do want to mention that we've talked about how common this is, and I do have stats for you. So even in young women, it's thought that about a quarter of young women have experienced some urine leakage through the days. And once you get closer to middle age and menopause, it goes up to well over 50%. And by the time you hit an elderly age, 75%, that's 3 out of every 4 women will have had some urine leakage. So that's why we say it's such a common problem. Women are embarrassed to talk about, but that's why we're here to talk about it today. So we can help you answer those questions that you never thought you wanted to ask anybody. So let's start by talking about, as you mentioned, the 2 types of incontinence. The first one that is the most common is called stress incontinence. And this happens because, so we have pelvic floor muscles. So these are muscles and tissue that lie like a bowl at the bottom of our pelvis, and they hold up our pelvic organs. So for example, they hold up our uterus and our bladder, and they also control the opening and closing of the urethra, which is the tube which urine uses to come out of the body. So it comes out of the bladder, out of your body to the urethra. So what can happen in stress incontinence is that abdominal pressure or stress can cause you to have lax muscles over time, and those lax muscles then prevent you from completely closing your urethra. So a stress like coughing or sneezing or laughing, etc., will actually prevent you from fully closing your urethra, and you leak a little bit of urine. So that's stress incontinence. So this is really common in women who have given birth, especially vaginal deliveries, and it's also quite common in women who are significantly overweight. So the second type, that's called urge incontinence or overactive bladder, is when you have this sudden uncontrollable urge that you've got to go pee right away. And I'm sure some of our listeners can identify. You are driving home and you're like, oh, I kind of have to go pee. And then as soon as your key hits that door lock and you're ready to go, and you're like, run. And you're like literally crossing your legs trying to get to the bathroom on time. And I see you laughing, so I know that it's not just me.
I don't know what you're talking about.
So yeah, that feeling of that sudden urge, your brain telling you that, yeah, you cannot wait. You have to go to the bathroom right away. And that feeling of, even if your bladder is not full, that you have to go right away, it can often be brought on by other things like being out in cold weather, or turning on a faucet and hearing the noise, or simply washing your hands. So that is stress incontinence. And then there are a few other types.
You said that was urge incontinence.
Sorry. Yes, you're right. Sorry, that's urge incontinence. And then on top of that, you can get a mixed picture where you can suffer from both stress and urge incontinence, a little bit of both. And then finally, there's a fourth type, which is less common, called overflow incontinence. And that is similar to what Dr. Jeethi was mentioning earlier, where there's a nervous system disorder or else previous pelvic surgery that doesn't let you recognize when your bladder is overly full. And so you leak urine because your bladder is too full to hold it, but your brain hasn't recognized that you need to go pee.
Okay, question for you. So, stress incontinence is actually a physical thing where your urethra is not closing all the way for whatever reason. But the urge incontinence, that to me sounds like it's something about your mind. Your mind saying, I hear the sound of water, I have to go pee now. Or I'm in a locked car and I have to go pee now. Is that all in your mind?
No, not necessarily. So again, the brain, which is responsible for the nerves that go to the bladder that tell it when it's full or tell it when it needs to be emptied, it's kind of it's an interplay between that. So yes, it isn't always when it's over full. It isn't always when you need to go, but it just, yeah, you're right. It's certain triggers that tell your bladder it must be emptied right away.
I say, well, I haven't experienced that, but I can only imagine, like, going on a road trip. Can you imagine? Like, you know, how many times you'd have to stop? I remember. So one of my daughters, she's going to hate me for this, but anytime we were going to go out, like go to the store, go on a road trip, didn't matter, we're going to get in the car, we're like, you need to go to the washroom first, because always we would have to stop. And so even if she went to the bathroom right before we got in the car, give her 20 minutes. I gotta go. And so we'd always have to stop. As soon as we'd get to the mall, she would say, I have to go right now. I'm like, we just went at home. So that maybe is a bit of an urge incontinence at an early age.
She's one of those 25% of young women. There you go.
Yeah. So, okay, now we know what it is. We know what the different kinds of incontinence are. What can we do about it?
Well, what we can do is talk to your primary care physician. So go talk to your doctor, and they'll ask you. We'll